Welcome to this session on food safety plans. The SFA's overall food safety program must include a written plan for each individual school in the SFA and be based on hazard analysis critical control point principles. Three main points are essential to developing this program: sanitation, temperature control, and standard operating procedures, or SOPs. Be sure that all of your food preparation areas are clean and sanitary, such as workers' hands, utensils, and food contact surfaces. Avoid cross-contamination. Temperature control means keeping cold foods cold and hot foods hot. Cook to proper temperatures and hold at proper temperatures. And be sure to record those temperatures. A basic properly calibrated food thermometer, either digital or dial, is all you need to check for proper temperatures. SOPs can be used both for sanitation and to verify the proper temperatures are being observed, as well as other aspects of the food safety operation. The purpose of a school food safety program is to ensure the delivery of safe food to children in the school meal programs by controlling hazards that may occur or be introduced into foods anywhere along the flow of foods from receiving to service. An effective food safety program will help control food safety hazards that might arise during all aspects of food service: receiving, storing, preparing, cooking, cooling, reheating, holding, assembly, packaging, transporting, and serving. There are two types of hazards. One specific to the preparation of the food, such as improper cooking for the specific type of food, whether it be beef, chicken, eggs, etc. And two non-specific ones that affect all foods, such as poor personal hygiene. Specific hazards are controlled by identifying critical control points, or CCPs, and implementing measures to control the occurrence or introduction of those hazards. Non-specific hazards are controlled by developing and implementing SOPs. A school food safety program should control both specific and non-specific hazards and consists of SOPs and a written plan for applying the basic HACCP principles. This guidance presents HACCP principles adopted to the SFA's develop an overall school food safety program for their jurisdiction and HACCP-based food safety plan tailored specifically for each school food service site within their jurisdiction. SOPs lay a strong foundation for your overall school food safety program. SOPs are step-by-step written instructions for routine food service tasks that affect the safety of food, such as proper dishwashing procedures, or for tasks that are part of the HACCP-based plan, such as proper cooking procedures. Each SOP should include instructions on monitoring, documentation, corrective action, and periodic review of the procedures as they are covering. Adherence to SOPs allows food service managers and employees to effectively control and prevent hazards. SFAs may already have SOPs developed and in place. The process approach to HACCP is a method of classifying food preparation into three broad categories. These categories are based on the number of times a menu item makes a complete trip through the temperature danger zone. The way food is prepared at each site determines into which of these three food preparation processes it will fall. Temperature, if not controlled properly during food preparation and service, can contribute to a higher risk of foodborne illness. Therefore, it is critical to manage the temperature of food. In order to protect food from potential hazards, it is important to keep hot foods hot and cold foods cold. It is most important to keep foods out of the temperature danger zone, which is 41 degrees Fahrenheit to 135 degrees Fahrenheit. To assign menu items to one of these three processes, consider the process and procedures used to prepare the food in each of your school's facilities. Determine whether menu items have no cook steps involved, undergo a cook step for the same day service, or receive additional cooling and reheating following a cook step. This will enable you to place each menu item into the appropriate process. Identify the number of times each menu item goes up, so heating, or comes down, cooling, through the danger zone, and classify items into the following food preparation processes. Process number 1, no cook. The menu item does not go completely through the danger zone in either direction. Process number 2, same day service. The menu items take one complete trip through the danger zone, going up during cooking, and is served. And process number 3, complex food preparation. The menu item goes through both heating and cooling, taking 2 or more complete trips through the temperature danger zone. Control measures are any means to prevent, eliminate, or reduce hazards. Collectively, control measures include SOPs as well as critical control points and the corresponding critical limits established in each of the three processes. Once you identify the appropriate process for each menu item, determine what control measures are needed to prevent the introduction of hazards at each stage of the food preparation from receiving to service. Decide which of the control measures are absolutely essential to ensure safe food. Identifying critical control points and implementing essential critical measures in the process approach, the control measures that are absolutely essential must be applied at key points known as those critical control points or CCPs. During the food preparation process to control specific hazards, so be it physical, chemical, or biological, a CCP is a key point where a step can be taken to prevent, eliminate, or reduce food safety hazards to an acceptable level. Loss of control at this point may result in an unanticipated health risk. You will find that despite the different specific hazards, the control measures used to prevent, eliminate, or reduce hazards in all menu items under each of the three processes are similar. Monitoring is an important step for an effective food safety program. Control measures, including CCPs and SOPs, must be monitored, controlled, and documented in writing. Monitoring involves making direct observations or taking measures to see that the food safety program is being followed. For example, the critical control points are managed by adhering to the established critical limits. Monitoring will identify when there is a loss of control so that corrective action can be taken. In establishing your monitoring procedures, consider the following questions. How will you monitor CCPs and SOPs? When and how often will you monitor? Who will be responsible for monitoring? What you are doing to monitor depends on the critical limits associated with the CCPs for the menu items. Final temperatures and time measurements are very important, and you should determine how you will effectively monitor the critical limits for them. Determining the appropriate means for monitoring is an important factor. If equipment is selected to monitor a specific CCP, you should ensure that it is accurate. The equipment you choose should also be appropriate for the monitoring function. When deciding how often you will monitor, you should ensure that the monitoring interval will be reliable enough to ensure hazards are being controlled. Your procedure for monitoring should be simple and easy to follow. Whenever a critical limit is not met, a corrective action must be carried out immediately. A corrective action may be simply continuing to heat the food to the required temperature. Other corrective actions may be more complicated, such as rejecting the food items that were not delivered at the right temperature or discarding food that has not been held properly. Your food safety program must include corrective actions. Employees must know what these corrective actions are and be trained in making the right decisions. This preventative approach is the heart of the HACCP program. Problems will arise, but you need to find them and correct them before they cause illness or injury. It is also important to document corrective actions when they are taken. There are certain written records or kinds of documentation that are needed to verify that food safety program is working. These records will normally involve the food safety plan and any monitoring, corrective action, or collaboration records produced in the operation of the food safety program based on HACCP principles. Record keeping is also provided as a basis for periodic review of the overall food safety program. In the event your operation is implicated in a foodborne illness, documentation of activities related to the monitoring and corrective actions can provide proof that reasonable care was exercised in the operation of your facility. Maintain records of cooking, cooling, and reheating temperatures and their CCPs in the food preparation process. Keep documentation as simple as possible to make record keeping easy for employees. You do not necessarily need to develop new records. For example, you may use existing paperwork such as delivery invoices for documenting product temperatures when receiving the food items. Employees are important resources for developing simple and effective record-keeping procedures. There should be an ongoing periodic review of the activities described in your food safety program. This step ensures that the food safety program is operating according to what is specified in each school's plan. Designated individuals, such as the manager, should periodically make observations of employees' monitoring activities, calibrate equipment and temperature measuring devices, review records and actions, and discuss procedures with all employees. All of these activities should take place regularly to verify that the program is addressing the food safety concerns, and if not, checking to see if it is needing to be modified or improved. Review and revise your food safety program at least annually or as often as necessary to reflect any changes in your facility. These may include new equipment, new menu items, reports of illness or comments on health inspections, or other factors that indicate how well your food safety program is working. Determine who will review the current plan, when it will be done, and how it will be documented. The success of a food safety program is dependent upon facilities, equipment, and people. The facilities and equipment should be selected or designed to promote safe food preparation and handling practices by employees. Review your facilities and correct or modify barriers to safe food preparation. For example, faulty or outdated plumbing or lack of appropriate thermometers could be a barrier to safe food production. Managers and employees need to be properly trained to successfully reduce the occurrence of foodborne risk factors. A food safety program is effective when each employee knows their role and is committed to making it work. Thank you for joining us today on this Food Safety Plan webcast.